Warm greetings to one and all. I am Dr.B.Saravana Karthikeyan, Professor, Department of Conservative Dentistry and Endodontics from SRM Dental College, Ramapuram, wish to discuss in brief about ethics in dental practice. I hope this brief discussion will be really helpful for all the budding dentists who wish to start and practice dentistry in a more ethical way. So to start with, ethics is basically the study of what is right and what is wrong in human behavior. It basically deals with the beliefs that are morally acceptable or morally correct. So then ethics is applicable to all the professional fields, with dentistry being no exception. So ethics is basically derived from the Greek word ethos, that means character. Or we can say that, okay, it is derived from a Latin word that is mores, that means custom. So it basically comprises of some moral principles as well as some legislative, rules. So ethics in philosophy is defined as the study and evaluation of human conduct in the light of moral principles. So in dentistry, ethics comprises of all these rules and the laws or standards that are applicable to all the members of our profession. So we basically follow the codes of ethics of the American Dental Association, as well as we Indians, we follow, in addition to ADA rules, we follow DCI, that is Dental Council of India, and Indian Dental Association, that is IDA rules of and standards. So in the word ethics, E stands for expertise, T for truthfulness, H for honesty, I for integrity, C for compassion, and S for sagacity. So expertise means that, okay, so we should have some adequate skill to execute our role in our field. And truthfulness, that is, we have to be truthful to our patients. So H for honesty, that means that, okay, so we should not tell lies. So the difference between truthfulness and honesty is different. So truthfulness, we should be truthful to our patients. And honesty, we should not tell lies. So integrity means nothing but the quality of being honest, okay, and being sincere. So that is called as integrity. C, compassion. Compassion means, okay, the understanding of others, especially their difficulty, understanding the difficulty of the others, and what necessary actions we are going to take. Okay, that denotes so the word compassion. Sagacity, meaning for foresightedness or perception to make good judgments. Okay, our ability to make good judgments. Okay, so whether we are able to diagnose, okay, the correct condition, or we are able to make good judgments about a patient or a person. Okay, that means sagacity. So coming to the principles of dental ethics, so it basically comprises of 5 to 6 ethical rules. So first one is patient autonomy or non-maleficence, beneficence, justice, and veracity. So non-maleficence meaning to do no harm, to do good, beneficence, respect for persons, that falls under patient autonomy. Justice, okay, being fairness or giving equal treatment to all patients. So truthfulness, so that comes under veracity, and confidentiality, again, it comes under patient autonomy. So patient autonomy comprises of respect for patients, that is empathy, as well as confidentiality. So to maintain the patient records. So non-maleficence means to do no harm. So beneficence to means to do good. So justice is nothing but fairness of equally treating all patients, and veracity means truthfulness. So the first principle, first to do no harm. So what does it mean? So we dentists should take utmost care that we are not inflicting harm to the patients. The patients are coming to seek genuine treatment from us. So we should not induce any harm. So the classical example of what I can give is that we should always wear our PPE gloves, okay, so that we are not infecting the patients or cross contaminating the patients. And sterilize all the instruments. If you are going to examine with or use unsterilized instruments, that definitely is going to cause some harm to the patient. Okay. The second principle is to do good. So at whatever the situation may be, so we should always aim to render the treatment to maximize the benefit to the patient. So this can be done by keeping ourselves updated in the current dental research field, as well as attending regularly the CDE programs, that is continuing dental education programs and conferences, to keep ourselves updated with the current research that is happening in dentistry across the globe. So respect for patients or persons. So that means that, okay, we should always involve the patients in the treatment plan. So this builds up the trust. So as we all know that, okay, the dentistry or the medical practice, okay, always runs on the patient doctor relationship. That is basically nothing, the trust that the patients they have on us. So we have to give respect for that, and by giving respect for the patients, by actively involving them also in the treatment plan. So justice, okay, so that means that, okay, so rendering treatment irrespective of the caste or creed or sex. And truthfulness, okay, so always tell the truth to the patient. For example, if you are encountering some calcified canal, so since I am basically endodontist, I'll be giving examples in the field of endodontics. Okay, so when a patient is coming to you with calcified canal, so if you are going to practice some basic dentistry, so you tell the patient or give a disclaimer. Okay, so you will that, okay, I'm not expertise in this. So what I do is I just give a try, because the root is calcified, root canal is calcified. Um, so if in case if you're not able to do so, I'll be referring you to the specialist. So you tell the truth what is going to happen. Okay. At the same time, you admit your limitations. We have to admit our limitations. There's no harm in referring to a specialist when in doubt. Okay, as well as we need to tell the truth of that particular treatment prognosis. So if you feel that, okay, the particular dental treatment will not last long, or will not give a long-term benefit, then please tell the patient the actual truth. Okay, rather than hiding the truth and then convincing them to get the treatment done, and later on the patient may regret and you may regret as well. Confidentiality. The next one is confidentiality, which is nothing that you want to maintain all the patient records in a confidential manner. You should not disclose one patient records to another patient, or basically to others. Okay, so we have to maintain that confidentiality. Okay. So coming to the ethical rules for dentists as prescribed by the Dental Council of India. So the duties towards the dentist. So what are the duties that we have to render towards the patients? So we should be courteous, sympathetic, and friendly, and we should be punctual in all the appointments, and should maintain a well-merited reputation, should conserve of patients' welfare, and should maintain the confidentiality, as I mentioned, and should never give discrimination about the religion and nationality in giving treatment to the patients. So what about the duties towards other dentists? So every dentist should cherish a proper pride in our critics, should not disparage them by act or word. For example, if a patient is coming to you who had some bitter experience with the previous dentist, I will say again an example in endodontics. Okay, if a patient is coming to you with pain in a mandibular molar and you are taking an IOPA, so you can feel that, okay, initially the patient has undergone some root canal treatment with access opening, and you are able to locate one broken instrument within the canal. So don't give up the previous dentist to the patient. Okay, because instrument can separate for anyone. Okay, so it depends upon the particular case, the particular situation. It can happen to you as well. Okay, you tell that, okay, so for this happens routinely in the during the endodontic treatment. So because of the complexity in the root canal, so you make the patient explain that, okay, so the previous dentist, okay, so has done this. Okay, so nothing wrong. So just you will give your best to either remove that instrument or bypass that instrument, okay, or you will refer to another specialist. Okay, but don't discourage your fellow colleague in front of the patient, which is very, very important. And when interested with the care of patient of another, mutual arrangements regarding remuneration should be made. For example, if you are going to refer your patient to another dentist in your absence, make sure that okay, you are paying the dentist properly. Okay, as well as the same thing, if your friend has referred a patient to you in his absence, okay, so make sure that okay, you refer the dentist, you refer the patient after that particular treatment, and refer the dentist back to, refer the patient to that dentist of your friend. Okay, so that should be done. That ethical practice should be always followed. And when dentist is called upon any emergency, for example, if the particular family dentist of that patient is not available and you are attending as an emergency situation, so make sure that, okay, so you retire in favor of the regular dentist and shall be entitled to charge the patient. You can charge the patient for that particular treatment or for that particular appointment, but make sure that, okay, you just, step back once the dentist, family dentist is available in town. So malpractice or negligence, so any breach of duty proximate that causes damages, okay, is a departure from standard of care and can be considered as malpractice or negligence. So what are the common elements of malpractice and negligence is that, okay, failure to meet the standard of care, perform procedures that are not competent, you are not competent to do, use materials that are not meeting standards, that includes the expired materials, okay, or that is not currently banned by ADA or DCA or IDA, and failure to properly diagnose. Okay, if you're not having adequate basic knowledge, or that you may always tend to diagnose you will be misdiagnosing that particular condition. So make sure that, okay, you have some basic knowledge, okay, of the subject, okay, of dentistry, to practice dentistry in a very appropriate manner. And failure to refer is also considered as a common element of malpractice or negligence. Okay, the most common malpractice or negligence I can say is that, okay, failure to use rubber dam in the field of restorative dentistry or endodontics. Okay, so actually we mostly we tend up, sometimes not using this rubber dam application for isolation. But this, if you're not using, what happens is that, okay, especially in endodontics, there will be ingestion or accidental swallow of your endodontic instruments, especially files or burrs. Okay, so and it may get dislodged into the patient's body. Okay, and when you take an X-ray, then you may find out like this, the chest X-ray or abdominal X-ray. You can find that endodontic file here. Okay, so this is what happens if you're not practicing dentistry under rubber dam isolation. Or make sure that, okay, you are doing some preventive measures by tying the file with a floss. Okay, so that if the file is and the patient is swallowing the file, you can retrieve it by means of that floss. Okay, and other protective measures. But make sure that, okay, as far as possible, do practice dentistry or restorative dentistry endodontics under rubber dam isolation to be safe. So other alleged errors in claims against endodontists include the treatment failure, a failure to meet the standards of care, broken instruments, treatment of the wrong tooth, paresthesia, inadequate precautions, or failure to warn or informed consent. So informed consent is nothing but you have to inform before you perform. So this means that, okay, you should address the patient, the problems, any significant risk regarding the treatment or alternate remedies and prognosis. So as I have explained that, okay, the typical cases that calcified canal case, when in doubt, you please refer it out. And the last point is emergency care. So it is the responsibility of every dentist to provide staff training in emergency management. That includes training in basic life support and assigning specific duties to individual staff members, and be familiar with the emergency phone numbers and availability of emergency drugs, which is most important thing. And it should be available in every dental clinic. So finally, some do's and don'ts in ethical dental practice is that, so do mention only qualifications in prescription, do not advertise. So do mention the date and timing of that particular patient treatment or diagnosis, and record precisely the history of present illness and condition of patient in specific or subjective terms, and carefully record all the medical legal cases, and keep updating our knowledge by routinely attending your CDEs or conferences. Some don'ts is that, okay, don't hesitate to discuss the case with your colleagues, okay, when in doubt. And if you are sick, don't examine patients, okay, so that you will you'll not give your infection to the patients, and never criticize others, especially other dentists, and do not adopt experimental method in treatment. So finally, to conclude, it is not enough that, okay, we do no wrong. We must also try to assure that, okay, others believe we have done no wrong. Okay, so with this, I conclude this brief discussion about ethics in dentistry. I hope this will be really useful to all the budding dentists who wish to and start their dentistry in an ethical manner. Thank you. Thank you, one and all.